Democratic candidates for president are misleading you on health care. In reality, Medicare for All will cripple the private insurance market, plunge the nation into economic recession, and bury us up to the neck in debt owed to shady regimes and shadow billionaires. Several Democratic candidates want to convince you that the federal government can pay for Medicare for All without raising taxes on the middle class. This is not possible, as Medicare for All will cost trillions of dollars a year and require the federal budget to be twice as large as it is today. There is no way to pay for this unprecedented growth in government that candidates vaguely call investments in American health. The numbers just don't add up. No American should agree to such a sketchy deal. It's time we got real. Socialized medicine is a relic of the 20th century. American ingenuity will find a better way. It always has. And if anyone tells you there are no solutions to be found in our great nation, well, they just don't know where to look. Thank you.
We have a healthcare crisis in America. People need affordable coverage, but banning private insurance is not the solution. Especially for those who are pro-life, healthcare remains a huge threat to American life. Statistics are staggering. 82 million American lives are in danger because of inadequate health insurance. Many liberals want Medicare for all, but it's simply not feasible because the pharmaceutical and health insurance lobbyists have too much sway in Congress. However, progressives realize we need a hybrid universal system where people can keep their private insurance and those who need coverage can get it without going broke. This will create real progress for our country. I am a committed Christian, and I believe healthcare policy should reflect my faith's teachings. Jesus always served the poor and sick with unbelievable love, respect, and understanding. As a country, we have failed to follow this lead. He would be in favor of healthcare for all. I believe in coverage for everyone who needs it, while still allowing for private health insurance. To promote a culture of life and support national security, we need to do something about the state of healthcare in this country. Cover everyone who needs it, but don't ban private insurance.
Hello, I'm David Grasso, and you're watching Bold TV. Today's burning question, could Medicare for All work in the United States? Let's meet today's panelists. First, we have Landon Dais. He's a cannabis executive, and Dion J, Pierre, a conservative writer. Welcome to you both.
Thank you. Thank you for having us.
Yeah, thank you for giving us your take on this very dicey issue. So we heard from both of you right off the top. Democratic candidates want to make healthcare socialized in the United States. Good idea or bad idea? Landon.
It's a good idea, but I think it should be a hybrid system because we have an ingrained private insurance system, which has a lot of jobs and research and development. So as long as we can create a true hybrid, as long as we have a true safety net where all people have some form of quality health insurance, I am for it.
I'm not going to take you to task, Landon, but your people want to ban private health care, especially those on the left, especially Elizabeth Warren, Bernie Sanders, et cetera, that group of candidates.
Those aren't my candidates personally. However, at the end of the day, they're trying to solve one issue. We have 82 million Americans who are without quality health insurance or health insurance at all. So if you're a pro-life person, you have to be pro-health insurance because we cannot allow our citizens to die with inadequate health insurance.
Okay, Dion, what do you think the conservative idea is to replace this current Frankenstein of a healthcare system that we have?
Well, it's not clear yet that conservatives in Washington have offered proposals. We've kind of been the party of no for some time, but it is clear that the Democrats are hustling the American people when they sort of on the one hand advocate single-payer systems and then on the other hand say they want a hybrid system. And we get into this with progressives. They always do this for decades. You know, with Barack Obama, we were told that the hybrid system, that would be the end of it. Everyone said back then, oh no, they're going to push for socialized medicine. And they did, and they're doing it now. They won't tell us how to pay for it. Kamala Harris was so arrogant on CNN as to say that we'll just get the money some way. And, you know, progressives have been at this now in America for over 100 years, and it's the same ruse every time.
So, you know, he makes a good point. The Obamacare was a bona fide effort to help people get coverage, and somehow it just raised costs. My health insurance used to be $350 a month, and now it's over $1,000. What happened? What can we learn from it going forward?
Well, two parts. A lot of reasons why people's insurance went up. One, it was a response from the insurance industry to kind of strike back. Second, because they raised what the quality of care is supposed to be, what the minimum you're supposed to receive as a health insurance issuer, that means there was greater cost because you were supposed to get a certain quality of care. The reality is, prior to that mandate, people were getting inadequate health care and not getting preventive services in the long run, which will save our countries in money and save people's lives.
Yeah, Dion, what do you think about the cost of this?
So that's simply false. The reason why premiums rose under Obamacare is because people were so unhappy with some of the plans that they began dropping out of their plans. And this is how health insurance works. You need enough people in a pool who are healthy paying their premiums every month. And what happens when they all start leaving, then the sick people who all need care have to pay more. So it's just, again, I think what you find in these conversations is that Democrats, they just have a lot of ideas, but they're not really sort of getting into the logic of how these programs are paid for, how finances work.
Yeah, so the cost of a program like this would basically double the size of government, and I don't think people understand that, is that our current federal budget's about $4 trillion, and Medicare for All costs around, according to most estimates, between $3 and $3.5 trillion. So more or less doubling the size of the federal budget. Is that really realistic?
I mean, that's the Afghanistan and Iraqi war. If you want to put it, that was $2.7 trillion.
Yeah, but that was over a really long time, and that was also a big bone to pick with on people on both sides of the aisle.
All right, no, so, my point is I always find I'm always bewildered by how are we going to pay for something when it's about taking care of our own citizens, but when it comes to our military-industrial complex, we have no questions about costs.
So the United States we have a U.S.-led world order. The United States is an empire that underwrites the national security of the rest of the world. So, you know, if you want to quibble about military spending, it's irrelevant to the question at hand. One of the main reasons the United States can't sustain a Medicare for All system is because our population is just too diverse, and so medical care costs are very variegated. And
so so we have diverse areas of Canada, we have diverse areas in England, in the United Kingdom. There's many countries that
but these are really, really small countries, not to side with a certain thing here, but, you know, this is a country of 340 million people. You just named a country with less than 40 million people and another one with less than 50 million people. Can we really compare those systems to the United States?
Yes, because we're Americans. We are able to do things. We can't use the conservative things. How do we do it? As a progressive, we need to move our country forward. It's about doing what is right. And doing what is right is never easy. If it was easy, we would always do it. It's making the hard decisions that's going to make our country better and safer. And that is what's most important. How can we sit back and say we're the most powerful country in the world? We are the smartest country in the world. But we're going to sit there with 80 million, more than England, more than Canada, of uninsured or inadequately insured Americans. That is unacceptable if you're a true patriot.
Okay, I'm going to give you the last word here because he's made quite a case here. We have to cover our people, but we can't double the size of government. So how do we do this?
The United States can fix its healthcare system by actually subjecting it to some degree of market principles. At the moment, prices are so out of control, mostly because people don't know what they pay for health insurance. If you have it through your employer or through Medicare, you're very sick, you don't care that you've gone through $2 to $3 million of care in a short period of time. And so when we start thinking about that, moral hazard, the cost of insurance for doctors, and other parts of the American healthcare system that actually rig market incentives and raise prices, then we can have a conversation. But we're not going to do anything by selling people pipe dreams. The United States already can't pay off its national debt, which is $22 trillion. Are the Democrats going to just saddle us with another program that's going to add more and more debt? I mean, how long will the American people be hustled like this?
Okay. Well, thank you guys so much for this very spirited conversation today.
Thank you.
Yeah, and thank you for being here for today's panel. Thank you all for watching. Have a great day.